for a couple of you guys to join the live because today I want to have a little discussion about people talking about they're getting MRSA, they're getting HIV, they're getting cellulitis, they're getting infections in the Dominican Republic. And of course, as usual, I am going to post the video on YouTube for the people that may join late and won't see the video. So let's jump right into that little discussion. I think it's a really illiterate comment, to be very honest. And I say illiterate because in the age of smartphones, we have so much information available to us at our fingertips. When I hear people making these very judgmental statements about the Dominican Republic or even other third world countries, because I'm from another Caribbean island as well, it kind of upsets me because I feel like a simple search or a simple gaining of knowledge would kind of prevent people making these ignorant, kind of illiterate statements because they obviously don't know what they're talking about. Let's jump first into the first one about I went to the Dominican Republic and I had plastic surgery and now I have HIV because I got a blood transfusion and I didn't have HIV before and I think that I have HIV because of the blood transfusion in the Dominican Republic. I don't care which part of the world you are, what country you're in, what continent you're in. First of all, when you are getting, I guess I should break it down into where does the blood come from. When you're getting a blood transfusion at a plastic surgery center, the blood is not blood that's donated and sitting there in the plastic surgery center that you're having surgery. So, prime example, let's talk about where I had my surgery, which is simpler. I can talk about what I know, right? There is no blood just hanging around on Cipla. Oh, she needs some AB, so let's just go in the refrigerator and pull out some AB and give her. No. The blood, when you're getting a blood transfusion at the clinic, at the surgery center, is given to them or brought to them. That's why you have to wait on the blood, right? From the blood bank. The blood bank, I'm sorry. Now, the blood bank, where are they getting their blood from? The blood bank is getting their blood from citizens, people that are going and donating blood, whether it's a blood drive or they're getting paid to give blood. In my country, let's speak about how it works in Trinidad. In Trinidad, when you are at the hospital and you need blood for a blood transfusion, they literally tell your friends and family members, can you guys come and donate some blood to the blood bank? This person needs to get a blood transfusion, and we're always welcoming to getting donations, right? So it's not if you don't give a blood donation that the person is not going to get the blood, but they like or they prefer that because they're going to get a variety of different blood types. So it's not that, oh, well, my family member needs AB and I have to have AB to donate. No. You can donate blood to the blood bank at the hospital, and this is the general hospital, no matter what blood type you have. And then the patient, whatever blood type they need, then the blood bank will go into their reserves and give that to them. So in the DR, it's very similar. There is not blood hanging around in the surgery centers just waiting on people. It's the blood bank that collects the blood, and then when the surgery center asks for whatever 2 bags of B positive, it's sent over to them, and that's why you, the patient, are waiting to get the blood delivered before you get your transfusion, right? Most doctors, typically, I know Dr. Rami does this, when you go to pay for your surgery, you would pay $300 for your 2 bags of blood. If you do not need the blood, because this now is because they are going to call the blood bank and reserve what particular type of blood you, the patient, has and you may need. So they're going to reserve the blood. When you don't use the blood, you never needed a transfusion, you're given back $280 because the $20 was the fee to reserve the blood. The same thing with Laurent. When I had surgery with Laurent at Cipla, it was the same thing. You have to pay your blood reservation fee. Back in those days, it was $10. And if you don't use the blood, you get back your refund. Or in those days, actually, you just paid the reservation fee. And then if you needed the blood, when they bring it, you would have to pay the doctor's assistant for your bags of blood. So it's not just tainted blood hanging around wherever that they're giving the people. When the blood bank collects the blood, they are going to screen the blood. I mean, to me, this is very logical or very common sense to me. That why would any country, no matter where you are, just be collecting blood from the general public and then giving it to... I honestly don't know if these women that make these really dumb statements are thinking that the surgery center has blood sitting there waiting for them, or that the blood transfusion at the surgery center is like just there with the surgery center itself. That this is not blood that's available at a blood bank that's used for the entire country's population. So that's what it is. It's not CIPLA has blood. It's the blood bank has blood available for the citizens of the entire country. So why would any country now, or why would any medical organization, which is the blood bank, collect samples from people and not test the blood and then just give whatever crazy blood to general citizens of the country? So now the country is going to have what? An outbreak of HIV or an outbreak of whatever other transmittable disease, hepatitis C, whatever, because they're just giving them random blood. And that's why I say it kind of upsets me, because this is, to me, very common sense. And even if it's not common sense, a Google search will pretty much give you the information you're looking for. That why would people be making comments and saying, I got HIV from a blood transfusion in the Dominican Republic, or I got whatever from a blood transfusion in the Dominican Republic. Like, no country, and I say country, not the surgery center, no country is going to have tainted blood hanging around to just give to random citizens of the country. Think about that statement. The economical, not just the health risk that's gonna run rampant throughout the country, the economical impact that it's also going to have on a country where now half the citizens are full of all kind of STDs or full of blood transmitted diseases. Like, that honestly makes zero sense to me. Why people would be in Facebook, on these groups, on Instagram, on these gossip Instagram pages, in the comments, saying all these really dumb... It really shows the intelligence of the surgery community. To me, it shows the intelligence of the women that are coming to the Dominican Republic to have surgery. That some of them, and when I say flea-brained, what? You'll be laughing, but that's why I made up that statement. Because those are the people that are coming down there spreading all this crazy ass rumors, and then other dummies are just running with it, running with this rumor and spreading it, and then more and more and more and more of them are believing it without doing any research for themselves. So that's the whole part about, oh, I got a disease from blood transfusion in the Dominican Republic. Let me give you guys an example that happened to one of my patients. My patient went to one of the popular doctors in CIPLA last year, October I think it was. Had her breast done, lipo BBL. She is an adult entertainment employee. Let's call it that. She's in the adult entertainment world. And she had a blood transfusion when she had her surgery. Months later, she messaged me and told me that she said, oh my God, I had, because I guess, when you're in that industry, you have to do STD tests, blood tests pretty frequently. She said, I did a STD test with my doctor and it came back that I am HIV positive. And do you think that I could have gotten it from the blood transfusion when I had my surgery? And I said to her exactly all what I just said to you guys just now. That I don't think that's possible. And again, guys, if you guys don't know this, you need to start using Google some more. The Dominican Republic and all the Caribbean countries is one of the fastest advancing technologically and economically advanced countries in the entire Caribbean. Even though the GDP in my own country is pretty high because we have crude oil as our export. And the Dominican Republic doesn't. But the country is so large and it's advancing so quickly, that is what they're known for in the Caribbean. So the DR, if you have money in the DR, there is nothing that you are lacking. Nothing. As long as you have money in the DR, you will be able to access the best of the best. So if you're going down there with no damn money and you don't have your $300 for your blood transfusion, then yeah, you're going to end up in problems, because where you're getting the blood now and your hemo is 6, right? Anyway, so my patient, when I told her, nope, I don't think you got HIV from a blood transfusion in the DR for those reasons. A couple weeks later, or a couple months later, I'm sorry, she messaged me and she said, you know what, it was a false positive. I have now tested myself about 3-4 times and it's coming back negative. So you guys have to be very careful when you go down there, and whoever you choose as your doctor to do your plastic surgery with, and what lab that they're using to do your results or to do your lab work. Because, and that's why when I say things, you'll be, well, I shouldn't say you'll, some of you'll laughing, joking, making fun of surgery bay. Oh my God, look, they put a picture up in Cipla, whatever, and guess what? The same thing I spoke about is the same thing that's happening right now. I spoke about all those multiple surgeries. I spoke about my husband's labs getting mixed up. Hey, Dr. Rami. I spoke about all those labs getting mixed up. And what's happening now? People are talking about they got the wrong blood because it was the wrong blood type. And when did they do their labs? And who's mixing it up? So you guys need to be really careful what doctor you're going to, what clinic or lab, I should say, is doing your blood work. So all Dr. Rami, he's there right now watching the live. I don't know, he's still there. All his patients are getting their lab work done at Centro Medico del Caribe. That's where I personally have done my labs in the past. Every time I go to the DR and I have to get a COVID test or check my hemo, that's where I go also. So I can honestly say that I've never had an issue at any time at Centro Medico del Caribe. Maybe you might have to wait for your results a little longer, maybe a day or two, but to say that they're mixing up people's results and giving you wrong information, I've never had that, and I've used their services a lot of times, more times than I could more times than I could count on one hand, definitely right now. So 2020 Surgery, no, there are a lot of surgery centers. Now I'll be honest with you, it's ridiculous. It's so busy because it's so many famous doctors that work out of there. It's ridiculous how busy they are. No, there are other clinics out there. There's other surgery centers out there. I mean, I don't even know how many there is. It's a lot. But again, these are the popular ones that people know on the internet. They don't know the little quiet little clinics that doctors do surgery in, you know. Somebody said if they get the wrong blood, the body will reject it in 10 minutes. That's crazy. That's crazy. And my hubby, like I told you guys before, he has a very rare blood type. The blood bank in America calls him and asks him to come and give blood donations because his blood type is very rare. So when we saw his lab work came back talking about he's O positive, whatever, we were like, what? That's not his blood type. You know, so that tells you that they're mixing up people's stuff with other people's stuff. So somebody saying, oh, I'm HIV positive, what if that is somebody else's results that she was given? Or somebody is saying that I am HIV positive, but I had surgery over there, you know, because they gave her somebody else's results now, you know. So it's crazy. It's really crazy. Next thing, let's talk about people saying, I got cellulitis in the Dominican Republic. I got MRSA in my back in the Dominican Republic. So let me give you guys some stories about people that I personally know. One girl, and she's a surgery vet, so it's like, what the hell were you thinking? How could you do what you did and got MRSA in your back? First of all, you guys that believe the whole, and I made that post on Surgery Bay, 2 or 3 days ago, and who went and reported it, and who said what on there, whatever. Anyway, that was a serious ass question. But you guys know I like to shock and awe. That's why I worded it the way I worded it. People who are going to the DR and having surgery and talking about, I'm not going to bathe for the 2 weeks I'm there. I was told to use baby wipes. I was told don't use the water in the Dominican Republic to bathe. Don't bathe after surgery. I'll be very honest with you. I don't know as women what kind of clean vagina you all have, or how dirty it is, or your personal hygiene on a normal day-to-day, what you all be doing and how you all live your lives. And I'm sorry for some of y'all men that have to honestly deal with that kind of nastiness. Because for the life of me, I cannot understand, if people don't know how to do something, why would you not ask? Why would you not ask somebody? Why would you not say to them, well, I was told you don't have to bathe after surgery. So is this true? Yes? No? Well, if it's not true, what should I do? Ask. Ask somebody. You all be following all these damn Instagram pages, right? All these so-called surgery vets, and whatever reason that they have a surgery page for, I don't even know. If it's for gossip, if it's for meeting celebrities, I don't know. All I know is my page is all about teaching people something. And if you don't know, ask. And if these surgery vets and surgery gossip pages, whatever, ain't teaching you all something, then DM me in my inbox and ask me, instead of making some stupid comment or some ignorant ass comment, right? And then looking foolish on the internet. So if you have surgery and you don't bathe for 2 weeks, and you use baby wipes to wipe your skin, and you use, I guess, baby wipes to wipe your vagina, hey, Dr. Catherine, and that's it. That's all you did. You use wipes, you got your massages, you go back into your faja, you went home. And then 4 weeks later, 6 weeks later, you have an infection. And then you say, oh, my doctor gave me an infection. That's how I got it. No. Let me tell you why you got an infection. You got an infection because you're nasty. And you didn't bathe with soap and water and anything antibacterial to kill the germs. Did you guys know that MRSA lives on your skin? Did you guys know that there are millions of germs and bacteria that live on our skin 24/7, 365? Whether we bathe every day with soap and water or not? There are MRSA and other bacteria live on our skin. That's the flora and fauna of our skin, right? Naturally. So if you now have surgery and you're not using anything antibacterial to wipe down any parts of your body, right? That MRSA that's living there, because any break in the skin, whether it is a lipo incision, a little incision to stick the lipo cannula in there, whether it's a big ass tummy tuck incision, it don't matter. Any break or tear in your skin, MRSA can enter your skin and you're gonna get an infection. It's not the doctor's fault. It's your fault because you're nasty. And I've been telling you all this for a long time. And when I see people talking this foolishness about, oh, this doctor gave me an infection in my back and this, that, and the other, and it's deep in my in what? In the epidural hole, whatever. Yes, the MRSA got in there because why? When you have surgery, and this is for the folks that whether you all had surgery or not, do you think the kind of pain and swelling that your body is in, that you can reach around to your back and wipe anything? Do you think you can even reach your butthole to wipe it after you poop? I'm dead ass serious asking you all this question. I am dead ass serious. Do people who have a tummy tuck, do you all think that you all could reach around and wipe your butthole after you poop? A lot of that is the reason why you have nurses, because a lot of times that is who is going to be wiping your butt, literally wiping your butt after you poop, because your arm, your body is in so much pain, you're swollen, your flexibility and mobility, you lose it. You cannot reach around there. So let's go back to the MRSA talk. So you're on antibiotics for 2 weeks after you have surgery. That antibiotics is now suppressing whatever bacteria and germs is in your body, right? And then you're off the antibiotics. You go home now 2 weeks later, week 3, and you had a tummy tuck or you had aggressive lipo, and you have fluid remaining in certain parts of your body, whether it's the fupa area, your abdomen, your lower back, whatever. You're not getting it drained with a needle. You did not go to any masseuse and get it drained with a needle. You're hearing me correct. You all be going to these massage therapists where you all live in America and they don't know how to do shit. They don't know how to drain you with a needle, or they want to talk all this American medical law talk and tell you what they can't do it and whatever. Or no, it shouldn't be done. But let me give you all an example. If you take your fingers, and let's say this is your fupa, right here, and you do this, and you start seeing that skin moving like that, like a waterbed, you have fluid there. And they're talking shit. And if they don't know how to drain you, you need to either learn to drain yourself, because there are videos on YouTube, or you need to get somebody who's a nurse, who's a CNA, who's a LPN, who is something that know how to use a needle to help you drain that. Because the first thing is, when you go to the emergency room in America and you tell them, yeah, I went overseas and I had plastic surgery in the Dominican Republic, what are they going to tell you? No, we're not going to help you. You can't get service here. You're going to have to go back to your doctor to get help there. And they refuse you service. They literally refuse to help you. And guess what? What are you going to do? Find a lawyer and sue them? No. At the very moment, you need medical help. So guys, if you have to go to the emergency room, please do not tell these people that you went overseas to the DR and had surgery. Okay? Let them tell them something. I went to Miami or whatever, and the doctor is on vacation, so he can't help me and I need help. They're not going to be like, oh, what's the doctor's phone number? Let me call him and verify you really had surgery. They're not going to do all of that. They may ask you for a name, but they're not going to call to verify all of that before they give you services. These are how people get infections, because now 2 weeks later you're off the antibiotics from the DR. Now the germs that were being suppressed, that's now inside your body, that's floating around in that fluid, and even if you don't have fluid, now let's say the MRSA germ is inside your skin because the skin had a break and it found its way inside of you because you were not wiping your back because you couldn't. And then baby wipes doesn't have anything antibacterial to clean your back. So let's say the nurses at whatever recovery house you all staying at ain't doing a good job, not surgery bathing you, not using any heavy cleanse or dial soap with antibiotics in it, with antibacterial in it, and just using a regular Huggies baby wipe or a dollar store baby wipe. Hey man, young doll, that's not getting rid of the germs. Your antibiotics is now over. Now the bacteria is able to flourish inside of you, and now 4 weeks later, 6 weeks later, you're telling people, I have an infection and the doctor caused it. No, it's not the doctor, it's you. Your post-op care, your horrible, irresponsible ass post-op care is what caused that. It's not the doctor's fault. This is the progression of how people get an infection. So when you all say you have cellulitis is when you have all that fluid in your fupa area, you didn't get it drained, right? Think about it. The body is 98.6 degrees, something like that. If you put some raw meat outside in 98-degree weather, what's going to happen? The amount of bacteria is going to start growing on that, in that hot, moist environment. It's the same thing. It's the same thing inside your body. You have all this fluid swimming around in your belly, in your torso, and you're not draining it. And what's going to happen? That is a prime breeding ground to get an infection. And then they're going to tell you in America, because everything in America is, oh my God, you have an infection. Now you have cellulitis. And now you have to get hospitalized. And now they have to cut back open your tummy tuck and put a, what they call it, the pump or whatever, I forgot what they call it. The thing to drain you, the little mechanical whatever thing that they stick on your body. Or that fluid builds up, and then what happens? It has to get out. It's trying to find a way to get out. It starts busting your tummy tuck incision that was healing, and then all that fluid starts pouring out. And then now, that little hole gets bigger and bigger and bigger and bigger, and now you have a big old nasty wound on your belly because how? Why? How? Proper post-op care after surgery. So let me tell you guys about the girl, the MRSA in her back with the surgery vet that I know. She's a Ferrera's doll. She was very, at least when I started joining these Facebook groups back in 2017, she was very big into these Facebook groups, and she used to, be in there a lot with them, whatever. Now I don't know. She had a backlift for her round 2. She lived alone, so she didn't have anybody to help her. And in our chat, she admitted what she did was wrong, and then she found out what was the cause of what. It's a wound vac. That's what I was talking about earlier. my girl, yes, thank you. My girl got her back lift, which is a big incision across your whole back, just like a tummy tuck incision. Didn't have anybody to help her change her dressing and her bandage daily, because yes, you are going to be leaking fluid out of that area as well. And she was also a big girl. When you are a fatter person, you have a lot more fluid in your body than a skinny girl. And I have seen this not only with myself, but with a lot of my customers. The slim girls, they barely have fluid. The big girls have a lot of fluid. And she was a big girl too. So she wasn't daily changing her bandages on her back with her back lift incision. Her fluid would leak out of it, wet up the bandages, wet up her faja. She would be wearing that wet faja all day. I don't know if she changed her faja every day into a clean one. I don't know. But she did admit that those were the two of the things that she was doing. So guess what happened? Sitting in a wet faja with this fluid and wet bandages on your back all day long, all night, or however long she had it, if it's a day, 2-3 days, without changing it, that is what caused the MRSA. And her doctor had told her that. Her PCP in America told her that. And then she had to get a wound vac for like a month. She had a big old hole in her back until it eventually healed. And I think he forced her to do some kind of whatever third-party study about going overseas to have medical tourism, plastic surgery, whatever, before he agreed to help her. So when you guys are on the internet reading people talking all this nonsense about my doctor gave me MRSA, my doctor gave me cellulitis, my doctor gave me an infection, whatever, guys, start using your brain. Start using your brain and start thinking. Start picking people's stories apart and start questioning them. What was your proper post-op care? What were you doing after surgery? Tell us what you did for this to happen to you. I'm not saying that every plastic surgeon, every surgery center, every surgery is perfect and they're all 100%. I'll put my head on a block for all of them. I will not. But every time you hear these stories about infections, especially infections, you have to start questioning these people and ask them what were they doing, and take it with a grain of salt. Because I'm pretty sure some of you all will miss the entire message of what I just said and say surgery bay is victim blaming people. No, I'm telling you all to use your damn common sense and use your brain. That's what I'm asking you all to do. That when people start making accusations and allegations, you need to start picking the story apart for yourself and start working out, well, what did they do, what did they not do, so you don't make that damn mistake. One thing I can honestly say about growing up in a very Caribbean household with very strict parents is that my mother, when I was growing up, would always tell me life examples is what she calls it. You see that person going down the street? You see how they're 15 years old and they have a child? Do you want that to be you? She had to drop out of school. What's her life like now? These are some of the examples my mother would give me. Do you want your life to be like that? Yes or no? Okay, so no, then don't do that. Then don't make that person's mistake. And that is the entire moral of my story. Is that when you hear people talking all this nonsense about they have infections, whatever, ask them. Ask them what were they doing post-op. And then you can decide, okay, well, you know what? This doctor messed up. Or no, she didn't do what she was supposed to do. So let's go into what should you do. Because you all know I only get an hour and then they're going to cut me off and then I'm going to have to restart the whole life again. What should you do after surgery? What should be your proper post-op care? Your proper post-op care should be, one, when you have your surgery, whatever procedure it is, it doesn't matter. You are not supposed to change your dressing or bandages until you see your doctor for your first follow-up appointment. You heard that. Do not remove your bandages the next day when you leave the damn hospital and start cleaning anything. You're not going to die, you're not going to get infection if you don't see a doctor for 2 days. And that's typically the time frame. You have surgery on Monday, you get discharged on Tuesday, by Thursday should be your first follow-up with your doctor. So Tuesday when you're discharged, Wednesday when you're at the recovery house, do not touch your bandages and remove them and clean anything. What you will be doing is surgery bathing the rest of your body. So let's talk about my recovery. house showers look like. I know what mine look like. I can't tell you about the other recovery house what their showers look like. Our showers have the detachable shower head with the hose. So that makes it super easy for you to surgery bathe. So that's why you should be bringing your heavy cleanse, your dial soap, your wash rag from home. Bring your shit because you don't know if the recovery house have it, doesn't have it, they're supposed to have it. What if they don't? I don't know. We just say making assumptions. So to be on the safe side, bring your stuff. Your bottle of heavy cleanse, your dial soap is a 2-pack they sell in Walmart for what, $1 something? And your wash rag, like 3-4 wash rags. 3 days before your surgery, you should be using heavy cleanse every time you bathe and then rinsing with water. 3 days prior to surgery, you should start bathing with heavy cleanse. So buy the big ass bottle, the 24 ounce or whatever it is, because the heavy cleanse is not sudsy, it does not lather up. Then the night before surgery and the morning of surgery, you should be bathing with your heavy cleanse. Now, you had surgery, you're released, you're back at the recovery house, you go back to the recovery house, it's now Tuesday, midday, whatever. That same heavy cleanse or dial soap, you're going to be suds. The nurses at the recovery house will be helping you. Again, I can't talk about other recovery houses because I didn't stay there. But I have heard stories where the nurses at some recovery houses are lazy as F. They don't want to help you or do nothing. They're more angry than anything when you ask for help, and they prefer to take the quick, easy route and take a baby wipe and wipe you down. So the nurses will be helping you. They're going to be helping you lather up your little wash rag, and they're going to start doing different body parts. Let's do the face first, behind the ears, the neck. Rinse it off because you're going to be bent over standing in the shower. Let's do your arms, under your armpits. Stick your arm out, rinse it off with the hose. Any area that has your bandages must not get wet. So yes, you're gonna be showering, surgery showering. You're gonna be leaning forward to get your face so it doesn't drip down onto your body. Or you're gonna be leaning, sticking your arm out, sticking your leg out. So you get that area rinsed without water getting on it. And yes, the water in the Dominican Republic, not no fancy bottled water, fancy osmosis filtered water, whatever. The regular water in the pipe, you can use that to shower bathe, surgery bathe, and brush your teeth, and nothing will happen to you. I have been doing it for months on multiple trips to DR. My husband, all the people that live there, because I'm pretty sure, again, common sense dictates, right, that the government is not going to have tainted water where people go and take a shower and they get some kind of infection and drop down dead, or their body parts start rotting and falling off, or some kind of nonsense. So yes, the water in the Dominican Republic, you cannot drink it or cook with it, but you can take a surgery bath before and after surgery with it. Before and after surgery with the water out of the shower and out of the faucet to brush your teeth, and nothing will happen to you. So that's how you're going to surgery bathe after you have your surgery. Now, once your doctor does the first follow-up and changes your bandages and your dressing, from that point on, every day now, before you bathe or after you bathe, whenever you want to do it, you can remove the bandages. The nurses, again, should be helping you do this. Remove the bandages and clean it with heavy cleanse or saline. I prefer heavy cleanse. Saline and heavy cleanse. Saline because, okay, so let me say it like this. Heavy cleanse and the wash rag to kill the germs from the area, around the incision area. Then you can use some saline around it, and that saline is because it helps dry up the incision so it starts scabbing, which means your body is now healing instead of the incision staying wet looking or whatever. So that's why I like saline personally. Then you're gonna dust with some Tecasol, Curaderm, Pulver de Sulfur. They're all the same thing because they're an antibacterial surgical incision dusting powder. Then put your bandage, put your tape, put your knitted gauze, cover it up, get back into your faja, whatever. If you have a burn, right? not netted gauze. You're going to do the same exact things you just did, cleaning the area gently, but you have to keep, when you have a burn, you have to keep it moist. If the skin dries up, it's going to start cracking up, bleeding, flaking, scabbing off, and you don't want that. If you get a lipo burn, and it's not the end of the world, guy, if it's a small lipo burn. If it's a big ass lipo burn, then yeah, that's a problem. But if it's a little something, it's not the end of the world. I've had multiple customers that has gotten little lipo burns, and it just takes maybe 6 to 8 weeks to heal, and they're good. Once they follow my instructions, they're good. You're gonna put some in the DR. They sell it. It's called Platsoon. You're gonna get some of that. It's not expensive. I think it's like $15 or $20 a jar, if so much, and it's a big jar. Put some of that on there, and then put a non-stick gauze pad. Non-stick gauze pad is the one that has the kind of plasticky material. It's not the netted gauze. If you put netted gauze, that's gonna literally rip your skin off when you're trying to remove it to clean it. Put your tape on it. Put a poisey pad or 2 over it to what do you call it? Give it some cushion and get into your faja. All right, let's start talking about the faja. Who is buying one faja? Meaning you get your stage 1 from your doctor, and guys, the stage 1 is literally like Spanx. It don't do shit for you. You should not be in that stage 1 beyond, unless you have like a terrible lipo burn or something, and you cannot get into your stage 2 because the compression will be too much. But if you have nothing wrong with your skin, you should not be in that damn stage 1 faja for no 13 days, 11 days. No, you should be in that stage 1 faja maybe 3-4 days, and then after that you need to be in your nice tight ass stage 2 faja. The stage 2 faja is the make it or break it of your surgery results. Whether people want to believe it or not, they want to say whatever they want to say, whatever. I'm telling you what I know, because I've done it and my clients do it, and they have wonderful results. Who's buying one faja? Raise their hands. Who had intentions of buying one stage 2 faja for $150 and call that George, and that's the end of that? Right? No, you should be getting, and throughout your surgery journey, if you are doing what you should be doing to get the best results, you're gonna go through 4, 5, 6, 7 fajas, because as your body changes, size, shape, dimension, and your swelling goes down, those fajas are not going to be fitting you good anymore. They're going to be warped after you get them altered maybe 3 times. So they're not going to be fitting you right. They're going to be digging into your armpit. They're going to be hurting in different areas. So you will have to get another stage 2 faja. And in the, how long I've had surgery? 3 years, 3.5 years now I've had from my first surgery. I've honestly probably gone through about 20 fajas. I kid you not. A couple months ago, I bought 2 again from Fahati. Fahati is the brand that I recommend because I know how good of a job they do in regards to shaping and molding your body and getting that crazy ass swelling and what do you call it, fluid out of you. Like, I don't recommend any other brand but Fahati. And all the other brands that I've tried, I have not had the same results. And the fabric, the material that Fahati is made from, I don't think any other faja company has been able to replicate that. And the owner of the Fahati store in the Dominican Republic, in Santo Domingo, he told me, he's like, we call Fahati the Mercedes, the Mercedes Benz of fajas, you know. So that's the brand I recommend. Guys, when you're leaving the DR, at least buy 2 fajas. So every day you have a clean one to get into. Especially you guys that are having your period, that's, you know, working outdoors, or where you're going to be sweating, and or you're working wherever in a store that you're moving up and down. Get 2 fajas minimum and get them altered before you leave the DR, because you should not be washing your faja every day in the washing machine and dryer. Why? Because that intense heat and cold, it makes the elasticated threads in the faja get damaged quicker, and you're gonna have to get a new faja, because then you're gonna start seeing all the little threads flaking out. So for longevity of your faja, you should be every day washing your faja by hand with whatever, soap, body wash, detergent, whatever, soap powder, whatever you want to call it, and then wringing it by hand putting it on a hanger, leave it in your bathroom to air dry. Next day, your faja should be dry. You have a new clean faja to put on. That's what I do. Even in my truck, that's what I do. When I go and into the truck stop and take my shower, I wash my faja by hand, wring it out, wrap it in a towel to soak up the excess moisture, come in my truck, put it on a hanger, and it air dries. By next day, it's perfectly dry. So I'm in a truck and I'm doing this. So you all who in the house have no excuse. Is that faja de Prada? No. Fajate and faja de Prada is two different brands. But I believe faja de Prada makes fajate, or it's vice versa. Fajate makes faja de Prada, but it's two different brands. Fajate is literally the brand, the name of the faja. Fajate, not faja de Prada. What else? I hope you guys learned something. That when you have your own surgery, that when it's your time, that I'm not going to be getting no inboxes from you all talking about, oh my God, Dr. So-and-so give me an infection, because I'm going to ask you, what did you do post-op? Did you follow all the things that you should be doing? Because again, it's not hard, guys. It is not hard. All these stupid rumors that people are spreading all over the goddamn internet, it makes them look, honestly, it irks my soul. Because it really makes me feel like, damn, these women are that dumb. Like, that's really, and it's an embarrassment to our gender. You know what I'm saying? Like, come on. I'm all about women empowerment and uplifting women and supporting female entrepreneurs and girl bosses or whatever. And then some of you all on the internet embarrassing our gender, talking all this dumb shit. Sounding like you all never left your state, you all never left your country, you never had a passport, you never been nowhere, seen nothing. But all you know is, let's talk shit about the DR, but I want to go down there and get some cheap surgery. Make it make sense. I don't know what you're confused about. The name of the faja is fajate. Fajate. The analogy was the fajate brand is the Mercedes-Benz of fajas because the fabric is so good and wonderful, and no other faja company has been able to replicate fajate's fabric. So I don't know what you're confused about. Will you be having these things in your recovery house? Of course. Come on now. You all should know by now, you all that have been following me long enough know that when I do something 1,000%. I give it my all. I give it my freaking all when I do something. And I do something so that as perfect as I can be. I'm a perfectionist. It may not be perfect in your eyes, but in my eyes, when I do something, I try to do it as perfect as I possibly can. And that's the God honest truth. So yes, all these different things that I've been through, experienced, heard people complain about over the years, have messaged me with this story, that story, the other story. I have taken all of that and have tried my best to incorporate all these things. So when people come to my recovery house, they should not have a reason to complain about nothing, because everything is provided for you. Recliners, not just in every bedroom. I'm going to have 3 recliners in the living room. So you all don't want to be in your bedroom, you want to come downstairs and watch TV, chill out, whatever. I'm going to have a reading nook area. I call it a reading nook, but it's like a little lounge area, whatever, besides the family room, besides the TV room, besides the dining room. All of them going to have recliners. So you guys can come down there and chill out. You don't have to be stuck in your room, even though none of the bedrooms in my house are small. They're all big ass bedrooms. Easily some of those bedrooms could fit 4 or 5 beds, but of course that's not the law, and I am doing everything according to the law, according to exactly what the Ministry of Health requires and wants. Is that the one that comes in blue? I have no idea what comes in the bag. But yes, same thing like I was saying earlier. People's comfort and peace of mind is, definitely something that I'm taking into consideration. Which is, when you come downstairs, you leave your air-conditioned bedroom when you come downstairs. Are you sitting in the freaking hot-ass 98-degree Dominican summertime hot sun? No, you're gonna be in air-conditioned. If you want to go outside in the patio and take some sunshine or take some humidity, that's up to you. But I am making sure that whatever area that you guys are going to be in the house, you have the utmost comfort that you can, when you're there. Whether it's, like I said, recliners in the living room, the couch down there, the dining room area, all of that's air conditioned. You know, not just it looks pretty decor wise. It has to also be comfortable. That people are, oh, this chair is pretty but it's hard, I can't sit on it. No, the chair is the chair is pretty but it's comfortable, that you could sit on it, that you could relax and enjoy yourself and whatever, you know, come down there and FaceTime with your family members, whatever, show out the house, I don't know, whatever you guys want to do. I have a back patio area, but there are patios upstairs. You guys saw in the video I posted. The back patio area, I still have to decide how exactly I want to decorate it. Not just patio tables and chairs, but you know, like what kind of plants, or because there's some big fruit trees at the house. There's one huge mango tree and one huge sapodilla tree. So right now they're bearing fruit. So I don't know, I'm going to decide for the patio area all what I'm going to put out there, that people, if they want to come out and take some sun, that they could enjoy. It's still going to be shaded with the trees and whatever, you know. So all of that, I guess, when I get down there, I'm going to decide, which will be in about 2 weeks. So you guys are going to be prepared to see a lot more being posted on this page in regards to the decor as it happens. Right now, my bathroom that I was building is almost complete. They put in the tiles, the toilet, the vanity. I think they grouted everything, so that's almost done. My like bookshelf style wall that I was having built downstairs in the living room, that's almost done as well. They are repainting the entire interior of the house for a second time, because the first time apparently there's things that we saw that added. So they're going to repaint the entire interior of the house. When I tell you guys, everything is brand spanking new. Brand spanking new. All the custom made furniture, the custom made beds, all of that brand spanking new, meaning nobody has sat on it before. It's going to be verging everything. So comfort is the name of the game. Not just it looks cute, not just it looks nice. Comfort is the name of the game, because I want to take everybody's stories and who sent one to me about whatever experience they had, how they felt, as also my own personal journey, what I experienced, what I went through, so that I can make sure that all these different scenarios and situations are covered, have been thought about, it's outside the box and things like that. Anyway guys, so we spoke about people talking about HIV in the blood. We spoke about people talking about they got MRSA, cellulitis. After they had surgery in the DR, they blamed their doctor. We spoke about all of that. We spoke a little bit about my recovery house. I'm going to put the video on YouTube, so if you guys join, you know, halfway through whatever, you'll see it on YouTube in the next day or two or whatever. So I'm gonna say goodbye. I will talk to you guys later.